Hello and welcome to 2021 Open Enrollment. Here is the agenda and what we will cover today. Eligibility, qualified events, your medical renewal, dental, vision, life, next steps, and due dates. All the benefits that we're going to review today will begin on January 1st, 2021, and will be locked in for 12 months. You cannot make any changes unless you experience a qualified event as noted here on the screen. Change of employment for significant other, spouse or domestic partner, birth of a child, divorce, adoption, things of that nature. Make sure you contact your CVR HR team immediately if you have one of those qualified events so you can review your options. If you go past the 31 days, you will have to wait until the next open enrollment period to make any changes. Eligibility. All employees working 30+ hours are eligible for benefits, aside from yourselves, legal spouse, domestic partner, or children up to the age of 26. We're going to go over your renewal with Anthem. First plan is your PPO 250, so $250 deductible for an individual, $750 for the family. Once you meet your deductible, you're going to go into the cost share with Anthem. So you're going to pick up 10% of the charges, and Anthem will pick up 90% until you meet your out-of-pocket maximum. You do have copays available in this plan for your regular primary care physician and specialist. So your PCP copay is $15, your specialist is going to be $30. Preventative care on all of the plans is going to be covered at 100%, which means no out-of-pocket costs for you or your dependents. Your lab x-rays, anything diagnostic is going to be a $50 copay. MRIs, CAT scans, or PET scans is going to be subject to your deductible. Urgent care is a $30 copay, and your emergency room is $250 copay per visit. Now, keep in mind, if you're going to be admitted, you're probably going to waive that. They're going to go into deductible and coinsurance at that point. You also have copays available for your medications, and you have several tiers. So you have your generic tier at $15, your preferred brand name, $45, non-preferred brand name, $75, and then your specialty medication is 30% up to $500. Your next plan is your PPO 500. So 500 being the individual deductible, 1500 being the family deductible. Again, if you meet that, you're going to go into that co-insurance or cost share with Anthem. Then you're going to continue to pay 20% of all charges until you reach the out-of-pocket maximum. And then you also have copays for your primary care physician at $25, your specialist at $50, and then your lab and x-rays at $25 copay here, and then that major lab, MRIs, CAT scans is deductible. The same for inpatient, outpatient services. Urgent care on this plan goes to $50 per visit, and then your emergency room copay is the same at $250. And then you have the same copays for your medication. Your next plan is going to be your PPO 1500. On this plan, that is going to be the individual deductible and $4,500 the family deductible. Again, if you meet that, you're going to go into the cost share with Anthem. You're going to pick up 20% of costs until you reach that maximum out-of-pocket. You do have copays available, $25 for your regular doctor, $50 for specialist, and then lab and x-rays, $25 copay, MRIs and CAT scans, PET scans are going to be 20% after deductible. Inpatient, outpatient surgery is going to be deductible and 20%. Urgent care copay here is going to be $50, and your emergency room visit here is going to be $250, and then you have the same pharmacy tiered copays. Your last plan is the PPO 1500 HSA plan. So this is a high deductible health plan. There are no copays on this plan. Everything is going to be subject to your deductible, including medication. The only thing that's not subject to your deductible on this plan is your preventative care services, so well woman, well man, well child checks, and then any preventative medication or FDA approved contraceptives. Those are also going to be eligible for copay or at no cost before your deductible. So on this plan, you're going to always show your Anthem ID card, you're going to pay the contracted negotiated rate to those providers. And again, your deductible is $1,500 on this one, and family is $3,000. Then it's cost share after that. So you're going to pick up 10% of the cost until you reach the out-of-pocket maximum, depending on what level you fall, either individual or family. Again, all services, doctor visits, specialist visits, urgent care, emergency room, inpatient, outpatient surgeries and services, those are all going to be subject to your deductible first. If you enroll in this plan, you have the ability to enroll in a health savings account or HSA, which you can add your pre-tax dollars into that account to help pay for these services. You can use that money for yourself, for dependents, for medical, for dental, for vision, anything that your doctor can write you a script for, you can use those HSA dollars for. A couple things here in regards to your Anthem benefits, maximizing your benefits. Keep in mind you have free services to all members, to everybody enrolled. A few ways to save some money is always use generic medications whenever possible. Use your telemedicine whenever possible as well for any diagnostic visits for yourself or dependents. You also have access to a 24-hour 365 nurse line, which can help you coordinate your care. They have your information at their disposal so they can speak to you in regards to conditions, drug interaction, things of that nature. So utilize those services as they are free. And also behavioral health resources, that again is free to you. And there is nothing that comes back to your employer in regards to utilization, nothing that is identifying you and how many times you use the services. So use those services as needed. I'm going to go over the HSA limits. So again, if you enroll in that final plan with Anthem, which is a $1,500 high deductible health plan, you compare an HSA. So again, these are pre-tax dollars that you set aside that go into an account. As they come out of your check, that account starts to build. And then you can use those dollars to pay for your medical services, prescriptions, your chiropractic services, dental, orthodontia, vision, contact lenses, frames, anything like that. You can use those dollars for. One of the biggest advantages of the HSA is one being pre-tax, so is your taxable income. You put that money into the HSA account, and then there's a threshold that you meet, then you can start to invest those dollars. Any interest earned on those dollars is also going to be tax-free for you. As we start to age, we can use those dollars to pay for Medicare premiums, things of that nature, withdrawal similar to a 401k, and there is no tax penalty there either. There are maximums in the 2021 plan year. As an individual, the most pre-tax dollars you can set aside in an HSA account is $3,600. And then if you're employee plus one or employee plus spouse or child or family, it's $7,200. And then if you're 55 and over, you can add an additional $1,000. Some limitations to the plan. Number one, you cannot be enrolled in any part of Medicare. So if you're enrolled in Medicare today, you are excluded from the HSA account. You can still enroll in the high deductible health plan. You just cannot have an HSA account. You cannot be somebody else's tax dependent, and you cannot be covered by a non-HSA eligible plan. Dental benefits here, we're going to go over those. So that stays the same. You have in and out of network benefits. So your annual maximum, how much you can use towards your services for yourself and all your family members enrolled in the plan is $1,500. Your preventative services, your cleanings twice a year, those are covered at 100%. Basic services such as a cavity, it's an 80% coverage. So if you use either the basic services or the major services, you will be subject to a one-time annual deductible of $50 for an individual or $150 as a family. Major services such as crowns, dentures, it's a 50-50 cost share between you and Anthem. And then you get an additional $1,500 to use towards child orthodontia, and that is a lifetime benefit. 2021 vision plan, so stays the same as today. So your eye exams that are available every 12 months to the date. For example, if you received your eye exam in 2020 on March 1st, you would have to wait until March 1st, 2021 to schedule that eye exam. So that's going to be a $15 copay. Your eyeglasses, you have a $130 allowance to use towards the eyeglasses, and then a 20% discount of the remaining balance. Your plastic lenses is going to be a $15 copay for that single vision, bifocal or trifocal. Contact lenses, elective, conventional, or disposable. You have a $130 allowance to use towards those contact lenses, and then you get a 20% discount if you go above that. Medically necessary or prescribed contact lenses are going to be covered at 100%. These are the company paid benefits. So these cost nothing to the enrolled employee or the eligible employee. So your short-term disability is going to cover 66.67% of your pre-disability income up to $30,000 a week. It starts after the 15th day of illness or hospitalization, and the benefit lasts for 11 weeks. Your long-term disability is 66.67% of your pre-disability income up to $10,000 per month, and this benefit starts after the 90th day. And the benefit duration does vary. Life and accidental death and dismemberment, the company does pay for 1 times annual salary up to a maximum of $300,000. Make sure that you update your beneficiary form as needed. Also, some other services available through the Hartford. You have beneficiary assistance counseling, estate guidance and will services, funeral planning, some concierge services, travel assist, and ID theft. You also have long-term care available and paid through by the company with Unum. So long-term care helps in the event that you're no longer able to work. So it could be something as, and I'm not going to say small because it's an accident, and up to leading to something as debilitating as Alzheimer's disease. The benefit is yours and is fully portable should you leave the company. Supplemental life insurance. So this is above and beyond what the company pays. So you may purchase additional life insurance in increments of $10,000. So it's going to be the lesser of 3 times earnings up to $150,000 for your spouse, $5,000, and the maximum, the lesser of 50% of your supplemental coverage or $50,000, and for children up to $10,000. Next step, so open enrollment is here. So what does that mean? You have your packet where you need to complete your enrollment. Please make sure you update all of your information, your dependent social security information, date of birth, and then also complete that beneficiary form as needed. If you have a qualified event through the year, and that should be a trigger to update those beneficiary forms. We do need everything back in to HR by October 27th for a January 1st effective date. Thank you for your time today.